The purpose of this test is to assess for pain, mobility, asymmetry of the ribs at the sternocostal and costochondral joint. The ICF category for this patient would be thoracic spine mobility deficits, thoracic cage stiffness with respiratory mobility deficits, and mid-back and thoracic cage pain with spinal and respiratory movement coordination impairment. It is important to gain consent before performing this technique. You're going to find the first rib or the second rib with your fingers, and then with an oven mitt of a hand, push down on the patient's chest. This is important because we do not want to make the patient feel uncomfortable, since it's in a sensitive area for some patients. If the patient has had any long-term thoracic mobility issues, there would be an adaptive change in mobility of these joints. Also, if the patient has costochondritis, which is inflammation of the cartilage that attaches your ribs to your sternum. Additionally, patients who feel like their chest needs to pop when they take a deep breath. Hopefully we would see an increase in rib cage expansion and respiratory measurement, decrease in inflammation and pain in patients with costochondritis.
For my video, I'm going to be doing the sternum to cartilage and cartilage to rib AP mode on my patient here. First, before we touch the patient, we want to make sure that we explain what we're doing and that we get consent. So are you okay if I touch your chest? I'm going to be feeling around.
Yes.
Now, when you go in, you want to try and find your clavicle and then your sternum, and then you should be able to find rib 2 and rib 3. So now that you have rib 3 found, you're going to take the outside of your hand in kind of an oven mitt form and just kind of push down in an anterior way, and you're going to work down from 3 to 8. To test where your cartilage meets your ribs, you would move about 2 inches laterally and do the same thing, push down from anterior to posterior. Now this can be painful for normal patients, but usually patients who have like costochondritis, it'll be extremely painful.